Welcome to the office. Hi.
Hi.
Welcome to the office.
Thank you.
What's going on? Well, you're coming from?
Idaho.
And what do you do up there?
I work as a nurse in the operating room.
Operating nurse. Mm-hmm. Okay. And what brings you all the way down to SoCal?
I've got L5S1 bulging disc.
That's what you've been told?
That's what I've been told.
Okay.
And then some other...
So hold on. Let's rewind. What's bothering you?
Left leg.
Those are just things on an image, right?
Yeah.
Okay, so tell me what's bothering you. What happened?
I don't have any specific event as to what led to it, but left leg pain, left and right back pain, numbness, tingling, cramps with the nerve.
All left-sided?
Mm-hmm.
Started when?
2018?
Early
2018.
What happened 2018? That's 2 years ago.
Yeah. Nothing
2.5 years
specific that I know.
No major slips, falls, traumas. You're active. You play sports. Activity. What do you do? Activity-wise, yeah.
I love to run, but I haven't been able to do that with the knee issues as well.
Okay.
And back. Hike is a big thing. Working out can't do because of all of this. So basically anything and everything active.
Has shut down.
Yeah. Because of this.
Because of this. Now, 2.5 years ago, what happened? Let's say 3 years before. You were working? You were at the hospital?
Yeah, just working, exercising.
Okay.
The usual.
And you just woke up?
No, I noticed some back pain, tightness, lower left back pain.
Okay.
And then that was really it. And then maybe 6 months later, I went and got an MRI. And then that's when I found out with the disc. And then it's just kind of gotten worse ever since.
So you were told L5S1 disc is herniated how much?
I think it was 2 or 3 millimeters, I think.
Okay. 2 or 3 millimeters. Okay.
Yeah.
And you were lying down for the MRI? Or you were seated, lying down? Okay. So what do you do with it?
And that was, I've been to several other chiropractors, several other physical therapists for months.
Doing what? Hold on, let's rewind. Going to a chiro or PT, what's the intent? You have a you're told you have a herniated disc at L5S1. So what's the treatment? What's the fix?
To try and get that bulge to suck back in, which they have failed to do.
Okay,
so
and how do they try to suck it back in?
They've done just some different maneuvers of trying to twist my legs and me trying to push my torso the opposite way, if that makes sense.
You were getting adjustments to reposition, and the idea was it's going to suck back in. Yeah. Okay, I need to correct that today. Okay. Let me get the model. Let me explain the mechanics, and then we're going to continue. This is really important. And why it's so important is there's a big misconception about this disc and how it subluxates, how it herniates. You remember way back in anatomy class? You remember those little things, those rivets that anchor the bone to the disc? They're called Sharpie fibers. Sharpie fibers are one of the strongest attachments in the body, similar to the ALL, or the anterior longitudinal ligament in front of the spine. So think of it this way. You have the bone and it's riveted to this disc. The disc has 2 parts. I know you know this part. I'm just recapping to understand. Okay, so you have the nucleus, which is the center or the ball bearing. It's a pivotal ball bearing which allows our 6 degrees of motion. Yes? And it's riveted down by those Sharpie fibers. The reason I mentioned Sharpie fibers, the disc cannot herniate without a trauma misalignment. And the misalignment takes the nucleus or takes the disc with it. So if it misaligns back, the nucleus goes slightly forward, right? Goes slightly forward, and then we have a slight tilting. Yeah? The weakest part of the disc is there. Posterior lateral, that's where we get the bulge or the irritation, right? The reason I'm saying this is the fix of this is repositioning, however that or whoever does it, okay? And I'm saying that in the lumbar spine, there's only 2 or 3 degrees of rotation. So this ain't about twisting. I just want to be clear, okay? I just want to be clear about it. Okay, let's continue. So you had some therapy, you had some adjustments. Anything give you any result?
One day after physical therapy, this was a couple months ago, I've had like 1.5 days of numbness tingling that was pretty, like, I shouldn't say not apparent. And then it was right back after that. So numbness tingling all the way down, and nothing's really ever helped it much.
Understood. Into the big toe, small toe?
Yep.
All the toes?
For the most part, big toe, occasionally the next two.
Okay.
Never felt it in the last two. But.
Okay. So we have low back, all left-sided. Mm-hmm. We have left knee issue as well?
And right knee as well.
So bilateral knee. Okay. And one started before the other, or?
Yep. Right knee, way long time ago. Left knee the last 2 years. Now this knee again. But.
So they're just kind of... Yeah. Okay. What else?
Neck's always giving me just kind of constant problems, and then right mid-back. Well, I should say by my shoulder blade. The last couple of months has really...
Right shoulder blade.
Yeah.
Okay. So left-sided to about here, and then it switches to the right side. Mm-hmm. Anything in your left shoulder, left part of the neck?
No, I get like really tight and stiff right here, but on both sides, but nothing.
Okay, and I'm going to explain that.
Okay.
I'm going to explain all of that, okay? Okay, so number one, low back. Mm-hmm. Shooting pain, numbness, tingling down the left leg into the toes. Both knees, they switch back and forth. Mm-hmm. Neck, more tightness. Yeah? Sleep is okay? Stiffness, tightness?
Yeah, sleep's okay.
Okay, digestion, going bathroom, all that fun stuff.
Mm-hmm.
Monthly cycles, all...
Not regular.
Okay. All right. Since the beginning or more recent?
I would say since the beginning, for most of the part.
Okay. Active teenager?
Yeah.
Sports?
Yeah.
Hardcore?
Yeah.
Like what?
We're cross country.
Cross country. Okay, yeah. So, and usually with cross country or so low body fat, mm-hmm. It does affect some of the cycles, especially early on. Right? You know that. Mm-hmm. You know that now as a nurse, right? Okay. All right. Okay. Anything else I need to know before we start?
Recently, in the last couple of weeks, right low back pain as well. That's been a little bit more apparent. I've never noticed that before.
Recent.
Yeah.
And do you notice you're compensating now?
Oh, yeah.
So you understand that process. Okay. So we'll go over all that.
Okay.
Now, I do, in your case, want to go over your x-rays first.
Okay, sure. Because
we got to point out some of those things that you were told, you know, a couple of things going on. I do want to mention it. Okay. Then we'll go through the gait analysis, watch you walk, do the exam, figure out where we're going to start. You want me to be nice now or do my job?
I want you to do your job.
Thank you.
Oh, tailbone. I forgot to tell you, my tailbone.
Yes.
It's killing me the last month.
I already circled it. Come over here. Let's go over it.
It hurts to sit, so
Okay. Wait, that's kind of important. It hurts to sit since when?
About a month.
And you don't have any recent injury on that you recall?
I just woke up one day and it just killed. I didn't do anything significant that I remember. So.
Okay, we're thinking of this as a 24-story building. Okay. Yeah, and the foundation of the building is this. In order to have a stable, level building, we need to have a level and stable foundation. And you're coming in telling me, I got a problem on the first floor. Mm-hmm. L5, first disc, right?
Right.
I got a problem on the first floor, but I already circled P2, P3, down to P5.
Right.
Down to the basement, okay?
Okay.
P meaning it's actually the sacrum. I'm just saying P as a joke, guys, that we got to go below the first floor.
Okay.
So in your scenario, we know the pelvis works in opposite, right? Mm-hmm. One goes up, the other goes down, one goes in, the other goes out. So let's go over your stuff. Here's what's interesting. Couple of findings. Number one, we do have a transitional vertebrae. I labeled it as an S1 or possible L6. And with that, there's a little bit of that spina bifida, right?
Okay.
Were you told any of this?
No, it doesn't really sound familiar.
Okay, I'll explain. Spina bifida is just non-union of the lamina to form the spinous process. Okay. In your case, though, it's not the lamina, it's part of the tubercle. Okay. So here's the difference. I've talked a lot in previous vids about sacralization. Sacralization is where L5 takes on the characteristic of sacrum, and now that person has 4 true lumbars. Okay. Then there's lumbarization. Lumbarization is where the first sacral tubercle or segment takes on the characteristics of the lumbar.
Okay.
So L6 or S1 is what I put here.
Okay.
Right? It doesn't mean you have more bones or less bones.
Okay.
It doesn't mean you have more nerves or less nerves. All it means is that it's modeled a little different.
Okay.
And someone in your scenario moving forward, someone who has 4 lumbars would be doing more flexibility. Mm-hmm. Someone who has 6 is a little more flexible.
Okay.
So you need more back strengthening down the road.
Mm-hmm.
Okay? Let's continue on now. So this is classic in the Gonstead work, page 43 of the Gonstead chapters, when you have a rotated sacrum on the side of an ilium issue. When you have an AS or an IN, major or ASIN, on the side of a rotated sacrum, it says to adjust the sacrum first. And it works in your scenario. Why? Because look, if I find the pelvis and I have to bring it down, what's it going to do to that? It's going to make it more, which is what I put.
Okay.
So the formula is if you're only getting your pelvis cracked on both sides, that didn't do anything.
Okay.
That's not the answer. Please don't do that.
Okay.
Your answer is in your sacrum.
Okay.
And now let's go closer. I want you to see this. So that's your tailbone down here, okay? You see how that kind of just brightens out? That's that. I'll show you on there. But here's what I want you to see. It goes like this. And then it bends like this. But where is the bend causing that? It's not, this is S1, S2, S3, it's S4, possibly even S5. So the part of the fix for you, and this is also the challenge, is you have a rotated sacrum on the left side. Now, we have to also torque it up on that side to help with that leg. That's a little bit of the art, the challenge. Okay. If you let me do it, I'll do it.
Yeah.
Okay, you're here. So, does that make sense there?
Yeah.
Okay, now let's look over here. We got some old tailbone injuries, and you even mentioned you noticed something like that, but you see the sacrum should be a smooth arc, right? Uh-huh. Yours went like this and straight down. So we had that nub there, I circled that one, and then we have a coccyx down low.
Okay.
So we have something S3, S4, coccyx, pubic bone, L5, and now I want to talk about this before we start. Now, I'm going to go over the level foundation principle according to the work of Dr. Gonstead. We're starting at the base of the foundation. This is our level base. First one to go off level is 5. 4 goes with it. 3 goes with it. 2 goes with it. 1 goes with it. 12 comes back to level. What that's showing you is all of this. If you're getting any pain or discomfort, that's compensation. Uh-huh. Okay? The next one to go off level from there is going to be 11. This is kidney area. This is adrenal area. This is energy. This is fight or flight. 10 goes with it. 9, 8, 7 comes back to level. Next one to go off is 6. 5 goes with it. 4 comes back to level. Next one to go off, 7. This is the digestion area. This is the adrenal kidney energy area. This is the foundation. Make sense? Mm-hmm. Okay. Now, the only other thing I want to point out up top here is you did something because your atlas, your C1, it's a little thinned out on this side compared to this side. Number 1. Number 2, we have a jaw deviation as well. Do you want me to deal with your jaw while you're here?
TMJ, I do have that.
Do you want me to deal with it?
Sure.
Okay, so I'm asking. So if we look at this as being center, it deviates away from the center which side? Symphysis mentis is on this side, right? So it's a right jaw, left compensation, right TMJ, left EX. Excuse me. You with me so far?
With ya.
All right, let's go over to the lateral X-ray. Any surgeries I need to know about?
Septoturb in my nose. So septum, nope.
Appendix?
No.
Gallbladder?
Nope.
Sure?
You still got them, yeah.
All right, let's go over this. We're designed to have 60-degree reciprocating curves. 60, 60, 60. Yeah? First thing we want to do here now, or next thing we want to do here, is do your posture assessment. You know about posture assessments, plumb lines?
No.
Guys, I'm tripping. Maybe it's me, because we learned plumb line in every office I was at had to do a posture line. So they take a weighted string and run it down the side. No?
No.
Oh, wow. Okay. Well, anyway, we're going to do it with the laser, okay?
Okay.
Lowest lumbar, we're going to take, level it off. It should go through C7 and C2. C7 just slightly forward. C2 definitely way forward. This is very, very significant for you.
Okay.
And let's say why. You have anterior head carriage up top, right? For every degree past neutral forward times 10 pounds you carry on your lower cervical spine. That's a good 30 degrees.
I know, it's bad.
30 times 10, 300 pounds, lady, you're carrying on your shoulders.
That's why they always hurt.
So but here's the good news. Your discs are great.
Good.
You may have an issue at C2 in terms of pressure, but overall, these discs are all great. Let's go back down. This disc is a little less, but still good. These are all good. Now, I want you to see, they look bad, but they're not. You see these circles? It's because of the curve. You're looking under the bone.
Ah, gotcha.
It's not a bad.
Okay.
Okay. All right. Discs are good. We're good. So we're going to go ahead now. We're going to watch your gait.
Okay.
Do you have any questions on the x-rays?
I forgot to mention something. My sacrum always feels like it's locked, like it won't move. If I'm trying to exercise with, my leg going back, it just feels like my sacrum's locked. Does that have? It is. It's locked. It's
10 millimeters of rotation on that left side. So it's doing this. Check it out. And I'm sure it's more fixed on the left than the right. So this is the sacrum here. It's doing this. Look. The left side, it's rotating back, like on this way. Should be here.
Gotcha.
It's gone out. And so all that swelling irritation, which will affect part of which nerve? Sciatic nerve.
Yes.
Okay. And first thing I want you to see is, you can see when we're looking here, look from the top actually, look at the dimples. You can see it's tilted or it's turned on that side. So you can see more of that swelling on that left side. Okay. Now, you can see in this position, if this is her upper back, this is her low, in a normal stance, she carries this upper part behind her foundation. So we're getting tension in these muscles, I'm pretty sure. And then the head is forward, we're getting all that tension up in here. Okay? Now, let's watch the dimples. They should move up and down, not side to side. Let's watch her walk back and forth several times. Slightly high on the right. Let's walk, please. Yep. Several times. Good. This is your walk. This is your normal walk. Okay. It's almost like a steppage. Right? It's like you're stopping and then starting.
Yeah, it's not very smooth. It's never been that way.
Meaning never since when?
I should say I've noticed it the last year for sure.
Okay.
Maybe.
Okay.
I don't know if it's been longer, but.
No problem. March in place in the center of the room. Take a couple of steps forward and march in place right there. So as I'm watching you march, no, you keep marching. Oh. You keep marching. I'm just pointing stuff out. So what I'm noticing here is this knee rotates in. Her arch is good, both sides. Her arches are good. This knee rotates in, and this tibia rotates out on the back side. Those are the two things I notice. Now, march in place, knees up high. Now my hand is right here. I'm going to have you look straight ahead. Keep marching. I'm going to have you close your eyes.
Right now?
Yep, close your eyes. Keep marching. And let's see where she goes.
Gosh.
I'm right here. You see? And she's off. Stop. Open your eyes. Okay. So there's two things. There is upper cervical instability when you close your eyes, but there's always also the pelvic imbalance, right? So when we march in place, whether eyes open, eyes closed, we should be in the same spot.
Okay.
Okay. And we're getting around 10 points. C1 on the right. T6, left side. And all of that is starting down S4, S3, S4, 10, 12 points right there. And go ahead and open and close your knees, please. Right side only. When she does the right, the whole left wants to shift. Do you feel that?
I think so, yeah.
Do the left side. The right wants to move too, but it's not from here. Everything is coming from right here.
That's where it always hurts.
That's the one right there, okay? So we have fixation on the SI joint on the left. Back slowly towards me. That's your L5. Okay, that's your L6 or S1. This is your S2. It's a little sharper here. I feel that. Do you feel that?
Mm-hmm.
Okay. Let's go down to S3.
Oh, that's painful.
Yes, S3. I have one more, okay?
Okay.
S4. 4, 3, 4.
Painful.
Yes, okay. All right. I'm going to be down on the coccyx now. On the yes? Not
yeah.
as... Yeah.
That, yeah.
More on the left side. More on the...
No, I want to say left. When it was hurting though, like a month ago when I felt it, it was on the right.
I'm feeling it right there. Okay? And I am actually feeling it on the right.
Okay.
Right side coccyx, S4 on the left. Let's statically palpate. Head down, please. Round your back for me. Nice and easy. Good. As we start here, you can see right there it changes. That's the orange peel. And it's between 6 and 8. 6, 7. 1, 2, 3, 4, 5, 6, 7, 8. This one. 6, 4, 3, 2. It's hiding right there. Right there. Okay. You feel that one too, right?
Mm-hmm.
Yeah. Okay. So patellar tracking. The patella is formed, or the knee joint is formed by the femur on the top bone and the tibia on the bottom. The patella or the kneecap sits in the middle, and there's a track or a groove that's formed by the union of femur and tibia. When everything is in proper alignment and we flex the knee, it should be a nice smooth glide. Okay, we're going to do that, and then we're going to add valgus and varus stress, and we're going to see if there's any popping or clicking. Okay, at the top of the kneecap, bend the knee. Good. Valgus, tiny bit. Varus. Valgus, but not so bad, right?
It doesn't hurt too bad.
Just a little tiny click at the end. That's it on this side. Now the left side. Bend the knee. Good. Straight, bend. Straight, and bend. Valgus, a little bit more there. Varus, not so bad. You know what the best rehab for the knee is that Dr. Gonstead used to recommend to all his patients?
What?
Pedal backwards. You have a bicycle at home?
Yeah.
Every morning when you wake up, 5 minutes a day, pedal before you go to work or work out.
Okay.
You will be working out again, okay?
Good.
But that's not the goal right now. Left ankle is also out. You feel that?
That hurts.
Yes. Left ankle. Right side not as bad. But I am seeing also posterior tib.
Yeah, that hurts.
Okay. So C1 right, T6, S4, coccyx, pubic, bone, posterior tibia, and AS talus, right side. That's where we're at. I can feel what I need to feel here, okay? In terms of what's going on with the jaw. I may need you to take it down a little bit. Right now we're okay. Open slowly, please. Open. All the way. Slowly close. Okay. Open, 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 open. Tight more here. There. Okay. Slowly open. And close. One more time, please. Right there.
Oh, yeah.
Okay. You can put it back on. Okay. So we found a few things. This is going to be the process. To be safe, we start with sacrum and atlas. We know there's stuff up here. We'll start on C1 in the chair. From there, we go here. We do S4. After that, I'll have you walk a little bit. Okay? Then we're going to decide. Now, there's sacrum, coccyx, and pubic. I don't know that I'm not doing 3 today. We have to figure, I know S4 is key. Okay. So we need to do that one, and we need to do the atlas. Okay. Then we'll recheck everything. Okay? Let's get started. Right atlas, chin down. Okay. C1 arch, posterior lateral, C1 arch, ASR, home run. Ooh. That was crunchy. You okay with that? Yep. Cool. Let's go over onto the gray table, please. L5, S1, 2, 3, 4. I'm holding nice and firm, okay? Are we good? Okay, breathe in and out. So in her scenario, we're doing S4. We're doing S4. I have to torque it clockwise to really get that lift. That's the home run, lady. You did feel that.
I didn't expect that. Yeah.
Nice. Clunk. Stand and walk it off. And just from that, tell us what's different. 4 or 5 times walk back and forth.
I think it's a little bit more free, like I can move.
Straight line, please. You know you're walking faster and smoother, right?
Yeah.
You do know that, right?
Like
you got more power. You're trying to walk faster.
Yeah, I feel it.
Just keep walking. There's a little more movement in the dimples now. Walk on your toes, please. Slow it down just a little bit. Turn around, walk on your heels, please. Pretty cool. Regular walking. One more time. Shoulders are getting level. The more you're walking, your shoulders are leveling off. That's pretty cool.
That's good.
Starting at the base of the neck. Atlas is clear, 0. Guess what? That cleared your T6.
Yeah?
Yep, for today. That cleared your mid-back. That was a good start. Sometimes we guess pretty good. I'm joking. Well, you know what diagnosis means, right? You know where the word diagnosis comes from?
No.
Oh, dude, you're going to laugh. You're a nurse, too. You should know this.
Yeah.
All clear down low. Now, let's check movement in the pelvis, please. Scoot forward. Feet together. Open and close your knees, please. Open and close. Good. Left side only. Good. Right side only. You do feel that, right?
It feels like it's not moving so much on my left when I pull it.
Meaning it's more free now. Yeah. Okay, come back slowly towards me in extension. There's your L5. There's your S1 or L6. Good. S2. Okay. Muy bueno. That's the start. Okay. Now we continue on. Ears. Now, there's a lot of instability here. Okay. All of this is coming or a result of that tailbone. Yeah. 5. You can deal with it. If it's too much, tap out. 5, 4, 3, 2, 1. 5, 4, 3, 1. Passive range of motion. 5, 4, 3, 2, 1. AS talus, medial tilt. Mm-hmm. Gotcha. Dropped fourth. That's it. Posterior tibia. I'm going to be using lotion, okay? We got to get, you feel that? Mm-hmm. Different from that side. That's tender also, but that one's definitely out. I'm going to traction, open up the knee. Let's work that meniscus back in. Now, again, as much as you're going to handle it, okay? Okay. If it's too much, you tell me, I'll stop. Otherwise, I have to push it back in. Okay. 5, 4, 3, 2. There. Hold on to the table now, please. Bend the knee. Bend the knee. Good. Oh, that clunked. Home run. What's different?
I feel like my gait's different.
You were getting stuck on your gait earlier. When we go back and look at it, it was very choppy, the walk. The walk is very smooth now.
Feels that way, yeah.
Right?
Yeah.
Keep walking, please. I'm going to be a little firm with you. Open. Open. Slowly close. So this is the last one that comes, okay? Open all the way. Open. Open. Slowly close. Open. Ah. Aha. Magic. You can put your mask back on. Let me use the machine now to break up some of that scar tissue in there. 5, 4, 3, 2, 1. Right one only. Over, baseball style pitch, around. Let me do the work. There. Hold on. Okay. Over, around, let me do the work. There you go. Muy bueno. Tiny bit on the radial head on the elbow. A little more. There. Squeeze hard. Squeeze hard. You do feel that, right? Squeeze hard. A little more. Lunate. Squeeze. Okay. Questions for today, Squeeze?
No, I don't think so.
Do you understand everything I found?
Mm-hmm.
Okay. Make sense?
Yeah.
All right. So we have a follow-up tomorrow, and then we need to figure it out.
Okay.
So tell us what's different.
I can walk a lot faster. I feel free. Like I feel like my hips are...
More movement?
Yeah.
That's what you came for, right?
Yep.
Now, walk for me, please. There's no wiggle. Shasha, there's no wiggle. Tiny, tiny. But there now that it's moving up and down. Yeah. Very good. Come on, seriously? You're clear up top.
Woohoo.
Why are you doing so good so fast? It's a nurse thing?
Yeah, let's go.
Must be.
I leave tomorrow.
That's what it is. Mid back is clear. Come on. I better find something. There it is. 10 points down in the sacrum. Open and close. Left side only. Right side only. Left side. They're still both kind of fixated, but that's because it's coming still from the sacrum here. It's not that one is more or less than the other side. Right there. How about the bottom one here? This one more?
This one more, yeah.
Then that one. Yeah, this one right there. Okay. And we got to do the coccyx today. So, right there. Hold your wrist there, please. I'm right on the sacroala, left side, right through. Oh, nice. Come on over here, please. Actually, let's go over here. Okay, 5, 6. This 1, 2. Okay, I'm going to bring the front down a bit.
Okay.
Okay, knees back a tiny bit more. That's it. Perfect. Now, slightly short leg on the left side, yes? So,
yeah.
So we're going to torque slightly this way, clockwise. You good with that? Okay. So we got a lot more flexibility. Gotcha. Nice. Come up slowly. Now you notice on this table, it's not a big cracky table.
This one?
Yeah, it's very just bam specific. Walk for me back and forth several times, please. Good. Mo better?
Yeah.
Turn around, please. Come over here. Check it out. You can actually even see the indentations, and the swelling is a lot less now. Okay, let's look here. Symmetry. A little higher still on this side, no problem. Tiny bit. We have good curve here. Go to the side, turn, and let's just get a profile here in terms of this and this. Okay, so we're good in terms of this too. Let's go ahead and walk one more time, please. Okay, let's go on the grade table. On the outside here. We're good? Okay. So we're taking the coccyx, we're actually tractioning it this way, lifting it, bringing it out. My contact is going to be like this. I'm not thrusting yet, and it's going to go like that, okay? Now, let me do this. Let's bring that up. Is that a little more comfortable?
Yeah.
Okay. Deep breath in. Now, let's bring it out. That's a piece. A little more. 3, 2, and out. There you go. Gotcha. You alive?
Yep.
Cool. Walk it out, please. Good stuff. Now, as you're walking, tell us all the stuff you're feeling or not feeling.
I feel like there's good movement.
Okay. So that which was blocked is moving now. Knees up high.
Oh,
Yep, knees up high. Walk. Turn regular walking, please. Come back over here. Stop there, march in place. Let's watch. Okay. My hand is here. March in place. You remember this?
Mm-hmm.
Close your eyes. Mm-hmm.
Not so wiggly.
Not so wiggly, but still going off a bit. Come back over here and let me double check something in the upper cervical, okay? Let's make sure everything is clear. Mid-back is clear. Low back is clear. That puffiness is almost all gone, by the way. Good stuff. Something is hiding still. Yeah, right there. Just gonna do C1 still, okay? C2 left, C1 right. Left hand up and down. There we go. C2, nice and easy there. And we just want to lift it up and turn that light switch on. There you go. Now come over here and do the atlas. This is called a critical atlas. There you go. Much better. Hi. Sit up straight for me, please. Good. Ears on your back. Raise your right leg. Raise your left leg. And we're going to do tibia today too. Let's go back over there, please. I'm going to use a little lotion, break up some scar tissue in there. You feel that little bulge, right? On the back of the knee that I was touching?
Oh, yeah.
Yeah. Okay. Bend the knee. Okay. It's going to be a little fun, okay? A little spicy. I mean, it's going to be a little spicy. As much as you can handle. If it's really too much and you can't, just tell me and I'll stop, okay? That's the lateral capsule meniscus. It's not the same on that side. You feel that? It's tender here, I know, but this is bulk. This is a lot more, what's the word? Prominent. Thank you. 5, 4, 3, 2, last one. There. Bend the knee. Let me do the work now. There it is. You got it up top? Sure? There. There you go. Gotcha. All set. Awesome. Walk it off one more time. One of the best rehabs for the knee and the patellar tracking, backwards pedaling or walking backwards.
Okay.
Okay. Keep going. Bueno. You feel the difference in your ankles as well, yes?
Yeah, I can tell earlier today.
Okay. Have a seat over here. Can we check your jaw, please?
We need this down.
Yes, ma'am. Slowly open. Wow. Close. Slowly open. You do feel it, right?
On the right, yeah.
Yeah. But I'm saying it's different overall.
Yeah.
I'm going to use this block in the back to stabilize the neck. Open all the way. Open. 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 Slowly close. There. Yeah. Open. Close. Open all the way. Open, 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 open. Close. That's it.
Oh.
Okay. What I'm going to do now, use the machine. Break up some of that stuff in the... You ready for your nose job? Face up. I'm not on the bone. The bone is here. Okay? The bone is here. This is the septum here. It's blocked on. Look. The bone goes this way, so it's still a little deviated. That's the left, that's the right. So it's actually more stuck here on this right side, there, okay? So what I would do is we're gonna set it there. I'm not on the bone, if you'd like, okay?
Okay.
Okay. Would you like me to?
Sure.
Okay. I mean, you came all this way, and then your nurse friends are gonna be like, did he do your nose? What did it feel like? You're like, I didn't do it. Why'd you go all the way and didn't get your nose? Chin down. I'm here, and I'm here. I'm doing the right septum. You got to bring the nose all the way over, all the way, just like that. That's it. Breathe in. And it's blocking all the way to your right TMJ here. You feel that? Mm-hmm. Okay.
It works.
Seriously, it wasn't bad, was it?
No, it wasn't.
And what's different right now? It is different.
I can breathe.
Okay. Different?
I think so.
Okay. You'll send us a message in a few days.
Yeah.
Walk it off for me, please. Good. Okay. Questions for me?
I don't think so.
Okay. You responded very, very fast.
Good.
It's all in your tailbone, sacrum.
Should I be avoiding doing like crunches, sit-ups, all that until maybe
Yeah.
see you?
I think you can do things like planks, hanging with leg raises, those type of things, twisting, right? Twisting the core. I wouldn't be doing this kind of stuff.
Okay.
Okay. Check the hands, please. Squeeze. Get your walks in, your hikes in, please. Squeeze. And no weights.
Okay.
Elbow. And elbow. There you go. We're all set.
Okay.
Have a safe trip back.
Thank you.
I'll see you in July.
Yeah, thank you.
It was a pleasure.